Hello student, very good afternoon to all of you. So we are going to start the recall session of physiology. So as you know, the mega recall session is going on. So this recall session is a part of the mega recall session, and here I am going to discuss the most possible answer of the physiology question. So I believe I am audible and visible at your end, student. So just if you give a thumbs up so that I can understand that I am audible and visible at your end. Just give me a thumbs up. I am waiting. Okay, then we'll start the answer. Okay, so I'll just wait so that I can understand everything is good. Okay. Okay. Thank you so much. Thank you so much for the, okay. So without taking much of the time, I'll directly discuss the answer of the MCQ, right? Because I know you have given the exam and you are pretty much exhausted, so you want a break. So I'm not going to take much of your time. I'll just tell you the answer of the recall. Okay. So first question that was given to me by students recall. A trekker at high altitude develop ataxia, confusion followed by pulmonary edema. Okay, what is the most appropriate management? So this is a very famous topic for NEET PG as well as FMG. I have discussed this in the last YouTube session also as well as in the RR also, and I told you the definite management is the rapid descent or the oxygen therapy. Now spironolactone you are not going to give this in this patient. Steroid is given for HAC high altitude cerebral edema, but not for the pulmonary edema. For pulmonary edema, because it has been mentioned, so pulmonary edema mein the drug which is given is the nifedipine, right? The calcium channel blocker should be given. Otherwise, steroid has no role for this high altitude pulmonary edema. So this is also not the correct answer. Acetazolamide, I told you that this is given for the enhancement of the acclimatization process, not for the treatment per se. So again, acetazolamide cannot be the answer. So now the last one, as per recall of the some of the student, rapid descent was given, but some of the students are saying this was not given. But even if the rapid descent is given, that will be my first answer, rapid descent. If it is not, oxygen should be the answer. If it is not, suppose something is given, digoxin or something like that. So in that cases, or none of the answer is correct, but in that cases, only acetazolamide can be a probable answer. So students are recalling that rapid descent was given in the choices. So I'll go for this rapid descent because that is the most appropriate answer in this question. I told that if not, then you may go for the acetazolamide, but that is not true answer. So rapid descent is given as per the confirmation. So thank you so much. That is the answer of this question. Next question, identify the breathing pattern shown in the images below. So again, this is the topic which I discussed in my RR also, in my recall, I mean in my YouTube session also. So I have shown you two pattern of breathing. One pattern of breathing was like this, irregular type of breathing followed by an apnea. So this was the Biot breathing pattern, but the breathing pattern which was given in your exam, that was typical crescendo discrescendo, means gradually this breathing pattern is increasing its depth, followed by gradually the depth is decreasing, followed by a pause, and this is typical of the chain stroke breathing. So all of you know, I believe you have done this correctly. So this was chain stroke breathing without any confusion. If this was the diagram, then it will be the Biot's breathing. It will be the Biot's breathing. Biot's breathing, there will be irregular period followed by apnea, but the crescendo discrescendo pattern will not be there in Biot breathing. Okay, so here answer is chain stroke breathing. Third question, a patient is brought to the emergency department in a state of shock. Laboratory evaluation performed reveal the following biochemical parameter: pH 4.5, bicarbonate 20, PCO2 25. I believe this is a little bit wrong recall because pH 4.5 cannot be there because it's a not sustainable pH, right? So obviously there is an acidic pH, but believe I, this is the bias in the recall. So we are assuming that the acidosis case was given because pH were less, right? It is 7.2, some of the students are saying, but 4.5, I don't believe that was the given. 7.3, yeah. So 7.3, assume kar lete, 7.3 was the pH, so acidosis case is given. Now acidosis means we all know either the bicarbonate, okay, should be low, so that can also produce acidosis, or the carbon dioxide should be high, that can also produce acidosis. But as you can see here, that the bicarbonate, okay, bicarbonate is low in these cases because bicarbonate normally is 24, so this is low. So this bicarbonate is matching with the pH. That means this acidosis is the metabolic acidosis. Now, whenever metabolic acidosis is happening, so only metabolic acidosis, only one option is there. So only this one is the correct, with the compensation of respiratory alkalosis, because we can find out here that the carbon dioxide is decreasing. So we can easily say that this is the respiratory compensation, and this is the typical phenomenon in the body whenever metabolic acidosis is happening. Respiratory alkalosis is the compensation. So A is the correct answer in this question. I believe all of you have done it correctly. Okay. Furosemide was in the option. So even if furosemide was there, if the descent was not there, then if first of all you tell me whether the rapid descent was there or not. Previous question, I think first question you were talking about. If the rapid descent is there, go forward with that. Okay. If rapid descent is not there, but suppose acetazolamide furosemide is there, then the furosemide can be given. But if the rapid descent is given, that is the best answer. Okay. So what if bicarbonate was 28? What if bicarbonate was 28? In that cases, it is not matching, dear. The bicarbonate 28, it cannot. Okay, there should be either higher carbon dioxide or bicarbonate should be lower, because if the pH is acidic, either first thing, the pH acidic means either the carbon dioxide should be higher or bicarbonate should be lower. That is the thing. Okay, then after the primary disorder, you check the compensation. Compensation is going in the same direction or not. That is the first thing. Okay, so most probably it was the metabolic acidosis as per recall of the most of the student. Okay, now next question. So next question is a pretty much repeat question. You have seen this diagram multiple times. So this is a diagram which is known as the cystometrogram. Okay, cystometrogram, and cystometrogram is a famous question for your FMG examination. All of you know that, right? And I have discussed in my YouTube session also, in my RR also, that this 1B portion is a famous question. The property of plasticity and the property of law of Laplace, both are applied in this thing. Okay, so whether it is the 1B, whether the plasticity option is given or law of Laplace is given, your answer for this 1B will be the same. So law of Laplace is the best answer here. So I explained in my last classes also why law of Laplace is applied here, because suppose this is the urinary bladder. Okay, whenever the urine is flowing more and more into the bladder, the pressure in the bladder remain constant. But why the pressure is remaining constant? Because the tension in the wall is rising proportionally. So T is rising proportionally, along with the filling of the bladder, means the radius of the bladder is also increasing proportionally. So Laplace law is saying P is equal to T by R. So in that sense, T is rising, R is rising, but P is remaining constant. So this is the application of typical Laplace law. Okay, so C is the answer in this question. Laplace law is the answer. Got it? Okay. Next question. Two MCQs was there regarding the action potential. Whether both of them were in the exam or only one was there in the exam, I do not know. But as per student, one question was there, the typical action potential diagram, and different point has been marked, which is the typical for NEET PG as well as FMG exam, you know. So this is a kind of repeat question, but only question that has been changed here. Combined transport of sodium and potassium means if you add up sodium and potassium transport, where it is minimum. So if you look at this action potential, this is the typical action potential diagram. So in action potential, you know, there will be, just a second, there will be movement of sodium and potassium, and I have told you in many classes that if you look at the sodium permeability, so sodium channel will open and then it will inactivate rapidly like this, and potassium channel, it opens, then it goes maximum and then inactivated like this. So if you look at this point here, sodium and potassium both channel are open and their flow is very high. So this is D is not the answer. At point number C, sodium flow is very high. So combined sodium potassium flow will be also very higher. So neither this C point will be the answer, neither this D point will be the answer. A point, obviously this is the resting membrane potential point, so potassium permeability is high. So this is also not the answer. So not the A is the answer, not the B is the answer, not the C is the answer. So only point that is remaining here is the point number E. So what is happening in point number E? As you can find out easily, the potassium permeability has decreased to almost minimum and sodium permeability is almost zero. So this is the point number E, or the part of the action potential which is known as the after hyperpolarization. So this after hyperpolarization is the point where the combined sodium and potassium permeability is the lowest, because potassium is going to reduce soon and the sodium permeability is already down. So this point number E will be the answer, or if ABCD is not given, then after hyperpolarization is the answer of choice. Got it? Okay. So you can tell me whether after hyperpolarization or ABCD was given. Anyway, after hyperpolarization is the answer. Now there is another question which is same action potential images, but question here is a little different. Question here is regarding the refractory period of action potential. If you read the question, refractory period लेके ये question दिया हुआ है. So what was refractory period? We know that refractory period is that point, that time point of the action potential where if you give a second stimulation, the second action potential is not going to happen. Although you have given a second stimulation, but second action potential is not happening. That is the refractory period. And you know, refractory period, first part is the absolute refractory period and the later part is the relative refractory period. So here the question is, why no new impulse generation? Impulse generation means action potential generation during the depolarization phase. So this depolarization phase, during this depolarization phase, second action potential generation, second action potential generation from this point is not possible. Why? Because that is the absolute refractory period. Now, what is the condition of absolute refractory period? Absolute refractory period means either the voltage gated sodium channel are already open. Open means they are generating one action potential. That's why they are open. Already they are open, or some of the sodium channel will go for inactivation. We do not say closed. Closure of the sodium channel takes long time. First it will go for open and then it will go for inactivation. So absolute refractory period means most of the sodium channels are still in the open stage or in the inactivation stage. So if I ask you during depolarization why the second action potential is not happening, your answer will be that this is the period of the absolute refractory period. During absolute refractory period, why second action potential does not generate? Because almost all the sodium channel either in the open stage or in the inactive stage. So if you look at potassium channels are closed, this is not my answer. Sodium channels are closed. I told you this word closed is not the absolute refractory period, it is the inactive. So this is not going to be an answer. Sodium channels are open. Yes, this is the correct statement about absolute refractory period. The channel which are already open, you cannot open them further, and that's why you cannot generate a second action potential. Because पहला का जो action potential है वो चल रहा है ना, वो क्यों चल रहा है? Because sodium channels are open है. Because if the channel is open, you cannot open them second time once again. Okay, first it will have to go to the closed state and then open. So that's why the best answer here in this question will be the sodium channels are open, or if the inactive word is given, then that is the best answer. So almost all the sodium channels are either in the open stage or inactive stage, but not the closed one. So closed is not my answer. So answer will be sodium channels are open. Got it? Okay. ठीक है ना? Okay. Next question is very pretty much easy question, because you know this is a very frequent question in your FMG as well as NEET PG. So pressure volume loop, you know, so A point to B point, this is the filling phase. Then point number B means this is the closure point of the mitral valves. Okay. Then point number C means this is the starting point of the ejection. So ejection point means this is the opening point of the aortic valve. So question was, at which point the pressure volume loop, the aortic valve open? So obviously the point number C will be the answer. So point number C is the opening of the aortic valve. Some of the students are recalling that in the image, they asked what is happening at point number C. Or some of the students are saying this is the exact question. So what was the question? Could you recall that whether they were asking what is happening at point number C, or whether they were asking this kind of question, A, B, C, D mark, and what is happening at aortic valve opening? What is the question? Could you recall anybody? This was the exact question, or they were asking in a different direction, ki what is happening at point number C? This was the same question. Thank you so much. Thank you so much. Okay. Thank you so much, Dr. Khan. Okay. Very good. Option aortic valve open. Very good, very good. So this is C is the answer. I believe you have done it correctly. Okay, because this is a simple question which has been asked multiple time again. Either. Thank you. Thank you. Okay. Next question. Now this question is a little bit difficult. This question is a little bit difficult. So generally what we read about compliance. So compliance, we know that it is the delta V upon delta P. Volume change upon pressure change. Now look at the question. A patient undergoes surgery when one lung is removed. So lung is removed means only one lung is surviving. So only one lung surviving means if you take inspiration, what will happen to the volume change in the lung? The volume change will decrease because total tidal volume is 600 ml, 500 ml. That is the combination of both the lung inflation. But when one lung is removed, only one lung is inflating. What will happen whenever you removed one of the lung? Suddenly, the compliance of the remaining compliance will decrease, because whenever we say about compliance, we think of the total expansion of both the lung, total expansion of both the lung followed by delta P. So if one lung is removed, only one lung is surviving, means total expansion, total tidal volume is going to decrease. If the total tidal volume is decreases, compliance will decrease. But question is not that. Question: which of the following parameters should be measured accurately to assess the remaining lungs elasticity? So now you have only one lung. You know that if you measure the total compliance, if you measure the total lung compliance, that is supposed to be decrease, because one lung is not there. So you are not going to measure the total lung compliance, because ये तो low होगा ही होगा, आपको पता है. So that is not going to give you the accurate value of remaining lungs compliance. So what you are going to do, you are going to check the compliance of the remaining lung with respect to unit volume of lung, unit volume of lung. And this thing is known as the specific compliance. What is specific compliance? Specific compliance is, okay, compliance of the lung upon FRC. So what is this FRC? FRC is an unit volume. So the lung which is surviving now, it has an lower FRC and it has a lower compliance. So now if I divide these two things, this compliance will give you the exact measurement of the remaining lungs compliance. So answer of this question will be specific lung compliance, option number B. This is the most difficult question in your paper. Otherwise, we generally read about normal compliance. In my main lecture, I have discussed specific compliance. I do not recall whether I have discussed this in RR or not. But specific compliance means compliance upon specific lung volume or unit lung volume. So in these cases, the specific compliance will be the best measure. Okay, chest compliance is not going to give you the answer. Static compliance is the same compliance which you measure. So that is not the answer. Okay, next question. A patient with a history of head trauma presented with the signs of increased intracranial pressure. Again, this is a repeat question, but in a different way. So increased intracranial pressure, ICT is increased, means there is increase in CSF pressure, which reflex you are going to see in this patient. You are going to see the Cushing's reflex. So this I have discussed multiple time in YouTube session as well as in RR, everywhere. Okay, so in Cushing reflex, all of you know that there will be increase in blood pressure, so hypertension will be there. So increase in blood pressure, along with there will be bradycardia, heart rate will decrease, along with there will be irregular respiration. So in this question, you have to choose the hypertension along with bradycardia. Okay, not the hypotension. So this B is going to be the answer, because it is the Cushing reflex that they are asking about. I believe you have done it correctly. Okay, so bradycardia with hypertension. Option asked which reflex. Okay, okay, doctor, got it. Okay, doc, got it. So I'll change the question. So what are the other choices in this question? Cushing reflex is the answer. Very good. What are the other choices, if you could recall any of the other reflexes that are, it is the answer. Cushing reflex. There is no problem. Fine. Perfect. Okay. Okay. So here Cushing reflex will be gone. Here bradycardia, hypotension. I got it. Okay. Bainbridge. Very good. Thank you so much. Bainbridge reflex. Okay. And baroreceptor or something will be like that. Got it. Thank you so much, dear. Thank you so much. Baroreceptor. Very good. So this is not Bainbridge, because if the hypertension with bradycardia is given, so Cushing reflex will be the answer. Okay. Okay. Thank you. Thank you for the recall. Okay. And this is another one. This thing I have discussed in my rapid revision. I told you that Chronaxi, Riobase, utilization time, ये तीनों चीज आपको पढ़ना होगा. And the curve which is given, this is also pretty much difficult question, but if you have listened my rapid revision, then I have discussed there. So this curve is known as the strength duration curve. This curve is known as the strength duration curve. So if you look at the x-axis, this is the duration. So A and D, this parameter should be related to time. And option B and C, जो B and C mark है, it should be related to voltage. So time means one is Chronaxi, one is utilization time. So if you drop this perpendicular on y-axis, so here the B will be the minimum voltage. इसको हम लोग बोलते हैं minimum voltage को हम लोग बोलते हैं Rio base. So B is the Rio base. B is the Rio base. B is the Rio base. So between A and D will be my answer. Then if you drop this perpendicular on x-axis, the minimum time for Rio base which is not required is known as the utilization time. So D will be the utilization time. So हमारा answer हो गया option number D is the correct. Okay. Now whenever you are doubling this B into C point, in that cases, the minimum time which is required, this time is known as the chronaxy. So A is the chronaxy. So A is the chronaxy, B is the Rio base, C is the utilization time. Option D is the correct one. Option D was given in the time, but anyway, whatever is given, you have to choose the minimum point which is on the y-axis, that is the Rio base. And from that Rio base, the point which is given in the x-axis, that is your utilization time. If you fix these two things, your answer is settled. Okay. There may be a recall bias regarding this option, but this will be the Rio base. This will be the utilization time. That's all. Okay. So this is all about the physiology MCQ. Okay. And there is no confusion regarding the answer. They have not given any kind of confusing question, but two questions are difficult. Baki remaining around 10 questions, they are mostly repeat question from the previous year. Okay. Which one, beta? Please explain this. Which one? This utilization time chronaxy, this one you are asking about. So in utilization time, chronaxy, Rio base, this if you are asking, then I told you that the graph is like this. The graph is like this. Okay. So graph का जो y axis है ये voltage axis. Okay. Yes, yes. Voltage axis, ये voltage axis. And x axis जो है, this is my time axis. Okay. Now ये जो graph है, suppose this A to B, this graph is known as the strength duration curve. Now, first of all, you have to look at this curve and you have to reach a point which is the lowermost point on this curve, lowermost point on this curve. If you drop a perpendicular from the lowermost point of this curve on y-axis, from the lowermost point of this curve, suppose this is the lowermost point, if you drop a perpendicular from the lowermost point on the y-axis, this point is the minimum voltage which is required to produce an action potential. That is known as the Rio base. So Rio base is the minimum voltage, minimum strength which is required, minimum strength of stimulus which is required to produce an action potential, that is Rio base. Okay. Now, from this Rio base point, if you drop another perpendicular on x-axis, so this is the minimum time. This is the minimum time which is required for the Rio base voltage to produce an action potential. This is known as the utilization time, right? Yes. Okay. Utilization time. And if you double this Rio base, if you double this Rio base, so double voltage, from that double voltage, if you have to drop on perpendicular on this curve, and from there, if you have to drop on perpendicular on time curve. So now this time is the minimum time which is required for double Rio base voltage to produce an action potential. This will be known as the chronaxy. Getting my point? So this is the answer that ये जो point होगा ये हमारा chronaxy होगा, ये हमारा utilization point होगा and ये हमारा Rio base point होगा. ठीक है? ओके सर प्लास्टिसिटी एक क्वेश्चन था प्लास्टिसिटी था कि लैपलास लॉ था ये हम लोग डिस्कस किया है यहाँ पे प्लास्टिसिटी था और वेदर इट वाज लैपलास लॉ क्वेश्चन whatever it was whether it is Laplace law or plasticity means if you stretch a smooth muscle okay so bladder में urine flow हो रहा है bladder में urine flow हो रहा है so there is stretching of the smooth muscle whenever you stretch a smooth muscle takes the shape of the new stretched condition मतलब उसको खींच के आप छोड़ दो उसी जगह पे वो रह जाएगा नया शेप में रह जाएगा इसको हम लोग बोलते हैं प्लास्टिसिटी प्रॉपर्टी इज अ डिफरेंट प्रॉपर्टी बट वन बी सेगमेंट not only explaining the plasticity it is also explaining the Laplace law property. Laplace law property means 1b segment is denoting that there is no increase in pressure within the urinary bladder intravesicular pressure नहीं बढ़ रहा है बट यूरिन आने के साथ साथ यूरिन वॉल्यूम इंक्रीज होने के साथ साथ वॉल का टेंशन बढ़ते जा रहा है. ओके, इसलिए whenever the urine is filled inside your bladder, you feel a tension in your bladder, so that tension is rising. Parallelly, the radius of the bladder is also rising, but pressure within the urinary bladder is not rising. That is the, yes, that is the 1b segment Laplace law. Okay, bladder compliance law of Laplace was not given. If that is not given, then plasticity, but it is not compliance. Compliance is the volume change upon pressure change. Okay, compliance you can measure, but the compliance will not be the answer. Okay. Okay, thank you so much. I got it. Most probably it was there, but again, there must be some recall bias. But anyway, I believe most of the questions are from previous topic only. That's why I told you again and again, please read the rapid revision. Okay, rapid revision बहुत सोच समझ के हम लोग बनाते हैं. उसमें most of the, almost all these questions you are going to get from there. Okay, thank you so much. Best of luck for your result. Okay, I believe all of you have done a very good job. Okay, and all of you are going to pass the exam. So my best wishes for all of you. Thank you so much. Take care. Bye bye.